I have dementia. My eyes do see, my ears do hear. I am still me, so let's be clear. My memory may fade, my walk may slow. I am me inside, don't let me go. Following the NMC Code 2015, confidentiality of the persons that will be mentioned in this video will be remained. The characters are Susan and Edward, not their real names. The main character in this story is Susan. This is her story of her dementia and how this illness affected her and her son Edward. It will also talk about the role of their adult nurse looking after her. Susan was diagnosed with dementia 4 years ago, and along this, she is also type 2 diabetic and is on insulin. Susan used to volunteer at the charity shop twice a week. However, with dementia, she rarely goes to visit them. Dementia is an umbrella term for a progressive long-term condition that affects the brain. The brain consists of the nerve cells called neurons that communicate with each other by sending messages. With dementia, these neurons are damaged by it, therefore messages cannot be sent from and to the brain effectively, which inhibits the body from working normally. According to Castledine and Close 2009, dementia commonly occurs in patients over 60 years. It is an irreversible chronic condition that leads to decline in mental and physical abilities. The Department of Health and Social Care defined long-term condition as a health condition that cannot currently be cured but can be controlled with the use of medication and/or other therapies. Susan knew something was happening, but she did not know what it was. She noticed that she was not paying attention when people are talking to her. Edward, her son, said his mother went downhill after seeing the word dementia written by the doctor. From then, Susan was always looking for the definition of dementia from the dictionary to remind herself of what she has and what it is. Dementia can cause a number of different symptoms. For example, memory loss, behavior change, difficulty in communicating, aggression, sight and hearing loss, perception and hallucination, walking about, sleep and nighttime disturbance, and apathy, depression, and anxiety. Edward had been very supportive to his mother, though he noticed recently that Susan's symptoms were gradually progressing and he is afraid of leaving her at home when he goes to work. There are currently 35.6 million patients with dementia as per Alzheimer's Disease International and World Health Organization 2012. Extracted from the Public Health England 2018, there are currently 850,000 people in the UK living with dementia. By 2025, over 1 million people could have dementia in the UK, and by 2050 this figure will exceed 2 million. Caring for a family member living with dementia can be challenging and demanding, and it can put a great strain in the carer's physical and mental health. However, Brooke 2016, cited in Broadity 2009, believes that caring can also be rewarding and can reinforce relationships, feeling empowered to care and support a loved one, learning new skills and building networks. Research has shown that diabetes can increase the risk of developing Alzheimer's disease. It is thought that diabetes-related blood vessel damage could lead to a reduced blood flow to the brain, which may be a factor in Alzheimer's disease development. This is evident in Susan's case. Susan felt that her dementia did not affect her diabetes management, because taking her medication and insulin administration became her daily routine. Though, Susan admits that she gets muddled up at times, and the way for her to remember if she had eaten during the day was to check the kitchen sink for bowls or plates. Susan feels something was going to need to happen. This is when the district nursing team comes into her care. The NMC 2014 have set standards for competence for registered nurses to achieve outcomes for the people in their care. Along this, the nurses must also follow the NMC Code 2015. The NMC Code sets standards for nurses and midwives to prioritize people practicing effectively, maintain safety, and promote professionalism and confidence. One of the main roles of an adult nurse is to care for their patients, and this is one of the 6 core professional values called the 6 C's in nursing. When caring for an individual, patient-centered care must be used so that adult nurses can individualize the patient's needs. Adult nurses can also create a personalized care and support planning to support people like Susan, who is living with 2 long-term conditions, to develop the knowledge, skills, and confidence to manage their own health care and well-being. Record keeping applies to care planning and is an essential legal requirement. It is important that record keeping of decisions follows the legal framework and professional and ethical values of practice. Rather than considering each condition in itself, personalized care and support planning goes for a more holistic approach, beginning with what is most significant to Susan. It will be a collaborative process between Susan, her son Edward, and the district nursing team. Allowing people with dementia to be involved in decision-making is central to their self-determination and feeling of worth. In addition, adult nurses can further promote Susan's well-being and comfort by using common health-promoting behaviors such as hydration and a balanced diet. The nurse may also explore the practical guide to healthy aging with Susan. This guide was published in partnership between NHS England and Age UK to help older people to stay physically and mentally well by offering advices to keep fit and independent. Working with other healthcare professionals such as doctors, audiologists, occupational therapists, dietitians, as well as social care professionals such as social care workers, helps to achieve aims that are set and work towards the patient. It is clear that effective teamwork can have a positive impact on Susan's safety and outcome. Susan felt she still have a degree of independence. However, she does not like to involve her son Edward in helping her with her diabetes management. Brooke 2016 still believes that it is important for families, friends, and carers to support the person with dementia to continue as far as possible with social activities, what the person can achieve rather than focusing on what they can no longer achieve. There are 4 ethical principles in healthcare examined by Beauchamp and Childress in 2001, and these are respected for autonomy, non-maleficence, justice, and beneficence. Respect for autonomy and beneficence is important to Susan. Autonomy is about being independent and having a control over making an informed decision. Autonomy is significant to older people for good quality of life and being able to live independently in their own homes. Promoting autonomy is therefore considered an important aspect of person-centered dementia care. Furthermore, when severity of dementia progresses, decision-making capacity decreases. In dementia care, the value of beneficence is the main responsibility. Beneficence is an act to remove harm and promoting good and well-being. If Susan's dementia severely declines over the years, the Mental Capacity Act 2005 will be explored. This applies to people over the age of 16 who are unable to make all or some decisions for themselves. In Alzheimer's disease, the person's brain will have low levels of a chemical called acetylcholine. This chemical helps to send messages between certain nerve cells. Evidence-based pharmacological interventions for Alzheimer's dementia is the use of acetylcholinesterase inhibitors. According to the NICE Guidelines 2018, the 3 acetylcholinesterase inhibitors, donepezil, galantamine, and rivastigmine as monotherapies are recommended as options for managing mild to moderate Alzheimer's disease. These medication prevents the acetylcholinesterase from breaking down the acetylcholine in the brain. It helps reduce anxiety, improve memory, improve motivation and concentration, and improve the ability to do daily activities. Susan is currently taking 5 mg of donepezil daily. Some side effects of this include nausea, vomiting, diarrhea, fatigue, insomnia, headache, dizziness, syncope, and to name a few. Donepezil is usually taken before bed. However, a study conducted by Agboton et al. 2014, nearly half of the patients taking donepezil at night reported nighttime disturbances. There are evidence-based non-pharmacological alternatives to dementia, such as sensory and multisensory stimulation interventions and cognitive and emotion-oriented interventions. Sensory stimulation consists of different techniques used to stimulate the senses in order to increase alertness and reduce agitation. Example to this is art therapy, which is defined by the British Association of Art Therapists as a form of psychotherapy that uses art media as its main style of expression and communication. Although some patients may benefit with this, Wang and Lee 2016 believes that it can also have some of its disadvantages because some patients may not have an art background, while some may have difficulty in completing the artwork. There are also other sensory stimulation interventions that can be suggested, including aromatherapy by using essential oils, music therapy, activity therapy, and Snowzellen multisensory stimulation. Cognitive and emotion-oriented care approach helps in improving cognitive, emotional, and social functioning to patients with dementia. Example to this is reminiscence therapy, which involves discussion of memories and past experiences with other people using certain stimulus such as photographs or music to suggest memories and make a conversation. A study from Woods et al. 2018 suggests that the effects of reminiscence therapy vary depending on the way it is given and where it is conducted. However, there is some evidence that reminiscence therapy can improve quality of life, cognition, communication, and possibly mood in people with dementia. Susan may benefit from these non-pharmacological interventions. However, compliance is crucial to this. Adult nurses have a legal duty of care to act in accordance with the relevant standard of care, such as the NMC code. The code states that nurses must listen to their patients and respond to their preferences and concerns. The nurse should respect, support, and document Susan's right to accept or refuse these interventions. It is also important that nurses must act in the best interest and educate Susan on the benefits of these treatments. The code also states that nurses must ensure that any information or advice given is evidence-based. This then gives Susan her autonomy to make an informed decision.